Welcome to the American Healthcare Report. I'm your host, MJ Lewis, registered nurse. How does the state of the American economy affect the healthcare you receive in the emergency room? As a registered nurse who has had the opportunity to work in hospitals from Atlanta to Miami to New York City, I can tell you with all certainty that the treatment you receive, whether you're insured, uninsured, young, old, black, white, rich or poor, has been directly affected by this recession. According to the Journal of American Medical Association, hospital emergency rooms are closing at an alarming rate, even as emergency room visits are rising. In 1990, there were approximately 2,500 non-rural emergency rooms with approximately 90 million patients coming through its doors. By 2009, there has been a staggering 30% decrease in the emergency room serving approximately 130 million patients. That's an increase of approximately 30% of people in need of emergency care. Why are some of the doors of the most needed emergency departments closing? It breaks down to simple dollars and cents. High need, low profit equals close the R's. With social programs being cut, coupled with the climbing rate of unemployment and uninsured people, emergency rooms simply cannot cover the cost of day-to-day operation. A growing number of facilities, in order to keep their doors open, are cutting the numbers of doctors and nurses they have on staff. According to the Bureau of Labor Statistics, in 2009 and 2010, there's been approximately 150 massive hospital layoffs each year, affecting more than 20,000 hospital employees. Get out your calculators again. More patients plus less doctors and nurses, according to the Department of Health, means your sick 5-year-old has only a 3 out of 10 chance of making it within 30 minutes from the ambulance to being cared for in the emergency room. Can Americans really afford not to reform healthcare? This has been MJ Lewis, registered nurse. You can share your experiences and feelings on today's topic with me on Twitter at MJLewisRN_AHCR. And now for my nursing notes. When the nurses come marching in. On Wednesday, June 22nd, nurses will take over Wall Street to voice their concerns over the country's financial crisis with the March to Heal America. Nurses will lead the community in demanding that Wall Street pay for the damages done to Main Street. Labor and community leaders, activists, will join the nurses in their never-ending fight to advocate for the common good. They will rally in front of the New York Stock Exchange as part of the International Day of Action called by the European Trade Union Confederation. Stay informed, stay healthy. Thank you for joining me on the American Healthcare Report.